Assalamu alaikum. In my last video, in which I tell you about the shortening of the quadricep muscle, when we're dealing with the osteoarthritis patient, and we focus on the short hamstring muscle, we focus on the mobilization of the patellofemoral joint and tibiofemoral joint, but we neglect the length of the quadricep muscle. So, if you have a patient with the osteoarthritis, you have to check the length of the muscle, and in this the patient have a prone position on his tummy, and you bend the leg. Now you see the bending of this leg is not at the range, proper range, so we have faced the shortening of the muscle. You always compare the length with your other leg as well. So in my first video, when I told you about the shortening of the quadricep muscle, most of our physical therapists and the patient asked me about how we improve the length of the muscle. So in today I tell you how to improve. This is the muscle energy technique. This is called the post facilitation stretch technique. So I going to mix through two or three techniques. One is the traction, the Calton bone knee traction. The second is the muscle energy technique, post facilitated stretch, and third one is the positioning release. So first you have to give the traction to the knee joint, and this is the Calton bone position. The resting position is for 25 to 40 degree. In this resting position, you have to give the traction of the knee joint. This traction of the knee joint improve the proprioceptions and relax the muscle as well. So we utilize a multiple factor to relax the muscle as well. So first step, 15 to 20 repetition of the knee traction. After the knee traction, you bring the knee in the middle of the range of motions and ask the patient to force it down, and make sure your body position, because the quads is a very heavy and strong muscles. You don't only give the resistance and produce the isometric contraction with your hand power. So use your body and ask the patient to put your leg down. Force 8 to 10 seconds. Isometric contraction of the quadricep muscle. Then ask the patient to relax, and you go and give a stretch, your first limit of the stretch, and maintain this stretch up to the 15 second. And the another before going to the another repetition, you have to relax the muscles. Or if you feel when you are going to stretch the muscle and patient have a resisted quads movement, so you can relax the muscle. So between the two repetition of the muscle energy technique, post facilitation exercise to resize the muscle, again you have to give the knee traction, 15 to 20 repetitions. Then isometric contraction of the quads muscle, push. You can use the patient breathing pattern with these isometric contraction. After the isometric contraction, relax, and after relaxation, the sustained stretch of the quadricep muscle up to 15 seconds. And relax. So through this technique, you can easily increase the length of the quads muscle. Thank you so much.